Thank you. So now we're going to be moving into our final set of polling questions for the day. We have a number of polling questions designed to get your experiences and thoughts about your current approaches to treatment. So you can go ahead and pull that up on your phones or your laptops, and we'll go ahead and jump into those. Okay, so our first question is please select the medications or devices that you use for Alport syndrome or the person that you care for uses for Alport syndrome. And please select all that apply. Your response options are A, ACE, ARB, beta blocker, or water pill, or other drugs for blood pressure. B, allopurinol, or drugs for gout or high uric acid. Statins, or other drugs for cholesterol. Voltasa, or other drugs for high potassium. Sevelamer, not sure how to pronounce that one, but or other drugs for high phosphates. Antidepressants or anti-anxiety drugs. Hearing aids. Glasses for Alport syndrome related vision problems. You do not take medication. Or finally, J, I do not use hearing aids or glasses, and please select all that apply. So we want to know all of the different medications and devices that you use or your loved one uses for Alport syndrome. Select all that apply. Give you a few more moments to get your responses in. I know there's a lot of options. Okay. So it looks like the most common, and again, just a reminder for these questions that allow more than one response, the percentages are not a percentage of respondents, but a percentage of responses overall. So the highest medicine or device that is utilized by those represented here in the room and on the webcast are drugs for blood pressure. After that, it looks like we have drugs for cholesterol and hearing aids as our third most and second most common treatment, respectively. There are a number of individuals that do not use either hearing aids or glasses for their Alport syndrome, as well as many that do use glasses. There's good representation across each of the other categories that we have, and only a very small number of you that do not take any medication. So our second question for you is please select all that apply, and the question is, I have had end-stage renal disease, and at least part of the time, A, you or your loved one was on dialysis. B, you or your loved one received a kidney transplant. C, you or your loved one has not experienced end-stage renal disease. Or D, and this is for caregivers, the patient you're responding for passed away or died while in end-stage renal disease. So please select all that apply to you or your loved one with regard to end-stage renal disease. All right. So while the responses are trickling in, it looks like the most common experience for you or your loved ones is that they have not experienced end-stage renal disease. However, those that have, there's more experience with having received a transplant than with dialysis, but experience with both. And no one has been choosing to respond on behalf of a patient that died while in end-stage renal disease that was either not on dialysis or received a transplant. So our third question is, how well does your current treatment or device reduce the most significant symptoms of your disease? And please select the one that most applies to you. The options are A, your current treatments and devices reduce the most significant symptoms very well. B, they do so moderately well. C, they do so poorly or not at all. Or D, you do not currently take any treatments or use hearing aids or glasses. So please select that which most applies to you with regard to your current treatments or devices reducing your most significant symptoms of Alport disease. Okay. It looks like nearly 2/3 of you report that your current treatment regimen helps with the most significant symptoms moderately well. A little over 20% of you, a little over a fifth of you, report that they are poorly or not at all helping reduce the most significant symptoms. 10% say that they do so very well, and just a few of you report that you do not either use any of these treatments or devices. So this question is, which symptoms do you have that are not addressed fully by your current treatments or devices? And please select all that apply. And your response options are A, hearing loss, B, anxiety and or depression, C, being tired, exhausted, or fatigued, D, vision problems related to Alport syndrome, E, gout, F, gastrointestinal problems, G, recurrent infections, H, swelling such as in your ankles or face, I, reduced kidney function, GFR, J, proteinuria or protein in your urine, K, hematuria or blood in the urine, L, some other symptom that you have that is not addressed fully by your current treatments, or M, you do not have any symptoms that would need treatment. So please select which symptoms that you have that are not addressed fully by your current treatments. Okay, so it looks like the symptom that is reported that you have that you report is not being addressed fully is proteinuria, followed closely by anxiety and or depression, being tired, exhausted, or fatigued. Just behind that, hematuria or blood in the urine, or reduced kidney function and GFR. After that, I guess really the second or third tier is your hearing loss and GI problems not being addressed. There's some experience with each of the rest, including some others. And then it looks like maybe one or two people said that they do not have symptoms. Okay, so this question is, if the side effect profile of a new drug was more severe than you currently experience with your treatments, but clinical evidence indicated that the drug would significantly slow the progression of your disease and or improve your quality of life, how likely would you be to take this drug? So again, if the new drug was more severe than your current treatments, but would either provide significantly slowing of progression and or symptom or improvement of your quality of life, how likely would you be to take it? Your options are A, you would not consider taking it, B, you're not sure if you would consider taking it, or C, you would consider taking it. Give you a few more moments. Currently, it looks like 3/4 of those represented here in the room today would consider taking it, and about a quarter of you are not sure if you would consider it. Nobody said that they would not consider taking it. All right. So this is a ranking question where we're asking you to select up to 3 factors that are the most important to you when deciding to select a new drug. Your options are A, whether the drug is taken by mouth, by IV, injection in the muscle, so the route of administration. B, how often you have to take the drug. C, evidence in Alport syndrome patients that the drug improves specific symptoms most bothersome to you. D, the number of side effects known for the drug. E, the severity of the side effects known for the drug. F, the cost and or whether it's covered by insurance. G, what your physician recommends. Or H, some other factor that's important to you when deciding to select a new drug. Please select up to the 3 that are most important to you. Results are still trickling in. Give you just a few more moments. As it currently stands, the factor which is most rated as a top 3 factor for the audience here today in the room and online is the severity of the side effects. Closely behind that is a second factor is the evidence in Alport syndrome patients that the drug improves the specific symptoms that are most bothersome to you. Number 3 would be the cost and or whether insurance covers it. And the number 4 factor looks to be what your physician recommends. However, each of these factors was selected as being a top 3 factor for some number of you, including some other factors that weren't mentioned on this slide. Okay, so our 7th question is, without considering side effects, so taking side effects off the table, which one of the following would be most important to you in a future therapy? Your options are A, evidence that the drug will reverse the decline in kidney function, or in other words, halt the progression of Alport syndrome and delay the need for dialysis, but has no effect on hearing. B, evidence that the drug significantly improves hearing, but has no effect on kidney function. C, evidence that the drug will improve your quality of life and prevent future reduction in quality of life. Or D, evidence that the drug will prolong your life. So please select which one of the following is most important to you in a future therapy. And this is without considering what the potential side effects of the drug might be. All right, while the final results are trickling in, it looks like it's clearly about 3/4 of you would select that the most important thing to you in a future therapy would be evidence that the drug will reverse the decline in kidney function, even though it has no effect on hearing. A more distant second is evidence that the drug will improve your quality of life or prevent future reduction in quality of life. Number 3 is evidence that the drug will prolong your life, and it does look like a number of you selected that there's some evidence that the drug significantly improves hearing, even though it has no effect on kidney function. And our final polling question is, in your daily life, what bothers you more? And so your options are A, symptoms from Alport syndrome. B is side effects from medicines that you take for Alport syndrome. C includes both symptoms and side effects are equal. D is that you can't really tell the difference between the effects of Alport syndrome and side effects from medicines. Or E, you do not have symptoms or side effects from medicines. All right, it looks like the thing that bothers you more for those that are represented here today are most reported is symptoms from Alport syndrome itself. After that, it looks like both the symptoms and side effects of drugs are equal in bothering you more. There's a number of you, kind of the third most common being that you can't really tell the difference between the two, side effects or symptoms. For some, the side effects are more of a bother, and then there is still about 10% of you that do not have symptoms or side effects.